Yeah, thank you very much. Good morning, everyone. Such a pleasure to be here to discuss the Europe's Beating Cancer Plan, more specifically in GI cancers and new opportunities for intervention. So, allow me to start with the evidence. That's what guides us in our work, which does not let us forget that cancer prevention, although still underrated, needs to be taken seriously as it is what allows for a positive feedback in regards to health outcomes and better chances for morbidity and, of course, lower mortality. So, Europe's Beating Cancer Plan, which we have developed through a year in the Special Committee on Beating Cancer, BECA, this plan, the report that came out from the Parliament, reinforces new opportunities for prevention, but implementation will be key because globally 1 in 6 deaths due to cancer and 20 million people are diagnosed with cancer every year. And this is also a clear image of the lack of action, especially on prevention before the settling of disease, because 30 to 50% of all cancer burden is preventable through lifestyle and nutritional risk factors. But when we talk about the preventative nature of some cancers, we must also address the social, economic, and environmental determinants of health. So the Parliament's position through the Bacchus Plan also states that we need to tackle unhealthy diets. In a world where more than 3 billion people cannot afford to consume a healthy diet and food insecurity is also a European problem, we need to consider issues such as quality of the fat, red and processed meat, and dialogue and strengthen this evidence in regards to what the industry has to offer in order for them to reduce sodium, sugar, and eliminate trans fats. We have also taken some really interesting steps on the farm to fork strategy and the zero pollution ambition, but we need to fight more and we need to fight disinformation and give tools to citizens to make better and healthier choices and have a better lifestyle. And this is done through health literacy. We must also discuss country-level justice strategies to improve health literacy and to promote behavioral changes with better action and campaigns. Another preventative point of action that we need to address is on the risk factors for cancer that are already known. Currently, we don't know 50% of the risk factors for cancer, but the other half is very well established. And these are tobacco, for instance, and alcohol, which accounts for approximately 750,000 cases every year. So Europe's Beating Cancer Plan strongly supports the goal of a tobacco-free generation, aiming for less than 5% of the population to use tobacco by 2040 when compared to the 25% of today. Another point that I would like to highlight from the plan is to support the recommendation by the Conquering Cancer Mission Board to establish a research program tasked with identifying effective cancer prevention strategies and methods in regards to commercial determinants of health and exposure to occupational carcinogens. So, just to finish briefly my intervention, and despite all the ambitious points in the plan, implementation will be the true key to have these points addressed, and it is crucial to assess and reevaluate implementation strategies across member states to ensure that Europe's Beating Cancer Plan reaches its full potential when it comes to prevention, namely in digestive cancers, whose prevalence is quite worrisome in many regions. Thank you very much again for the invitation and for being here today.
Thank you very much, Sara.